Hi, it's been about 2.5 months since my prostate surgery, and I wanted to just give you a quick update on the last few weeks. Certainly, things are a lot better than they were in the first few days. There's a couple of major side effects that a lot of men struggle with in the early days. Probably the most inconvenient one is incontinence. And I'm, like I said, 2.5 months in, and I'm still using a pad daily and probably will for quite some time, just in case there is an accident. However, I find that there's very, very little leakage at this point, and I attribute that to diligently doing at least 100 kegels a day. So 10 repetitions, 10 times a day at minimum, um, have really, really helped. So I'm back in the gym. I'm doing cardio. I'm doing squats. And even during those stressful exercises, find that I don't have leakage. That at the end of the day, there might be just a little bit within the pad, which is normal and definitely something that you can live with and manage. And like I said, it's 2.5 months in, so who knows a month from now what that will look like. Um, the other major side effect is erectile dysfunction. And unfortunately, I haven't seen full erection yet at 2.5 months. However, there has been some rigidity that I've seen, and I'm currently on a 5 daily milligram dose of Cialis just to keep the blood flowing, as well as an on-demand. I tried the 20 milligram Cialis. It didn't really do much for me, so they moved me to Viagra at 100 milligrams, which is the highest dosage. And it's worked fairly well a couple of times. It's kind of hit and miss, to be quite honest. I never know if it's going to do what I want it to do. But at 2.5 months in, the doctor says that's completely normal. It takes time for the nerves to heal. It's a very traumatic surgery for your body, and it can take up to 6 months to a year to completely heal. So don't let that, you know, affect you mentally. It's very difficult, but just know that you just gotta let your body heal and give it time. So, still working through that, but overall, I am seeing progress from even just a few weeks ago, where there was absolutely no rigidity, and now we're starting to see that again. So that's that. Um, Also, just want to highlight that there are definitely good days and bad days. And I didn't share this earlier, but a few weeks ago was a extremely, extremely rough week for me. Um, I think physically there were a few setbacks. Went on a long walk with the family and just felt like there was more leakage than I had expected for some reason that day. I had a good week up until then, and that was very discouraging. Um, I was very tired that week. I was back to work, and around 3 o'clock in the afternoon, I would just feel like I had no energy left, no mental focus. Um, Pretty much could set my watch to around 3 or 4 in the afternoon. Between 3 and 4, I would not only get tired, but I would also get very, very cold and really shake with chills. But at night, I would wake up drenched in sweat, and don't know exactly, even to this day, what happened. I did go report this to my urologist, of course, who's managing my prostate cancer, and he did not think that it had anything to do with the medications. I also that same week had a very bad reaction. It was the first time that I took the Viagra, and thought that I had a very bad reaction to it, but don't know if that was actually related because I haven't had that reaction since. But was down for 2 days. Felt very nauseous. My heart rate was really up. I'm a runner, so my resting heart rate is relatively low, and my resting heart rate was around between 100 and 110, which is very high for me. On top of all that, I was feeling good few weeks before, so I signed up for a 10K, and had run 5.5 miles a few times with no issues. Got to mile 2 and just felt tremendous pain, kind of in my groin, sort of where one of the incisions were for the surgery, and had to walk the rest of the race. So there was a lot happening that week. Went to my primary care physician. They ran a battery of tests. Didn't find anything. Saw that I was slightly anemic, but nothing alarming. I did go back though and ask them to run some additional blood work. One of the things that I asked them to do is run my testosterone levels, and I am on the low side, around 330, which is within range but low. But my free range testosterone is outside of the range on the low side, at like I think 4.2, and I think it should be 6 point something is what she was saying. So I don't know if maybe there is a hormonal imbalance that was causing a lot of my symptoms, but it certainly took its toll. I'm happy to report that now I'm feeling much better. In addition to the physical symptoms, there was also, I think for the first time in my life, I really felt depression. I was not only tired, but really not only just sad, but almost just kind of empty, where I just didn't really want to do much, just wanted to stay in bed, and that's definitely not my personality. So weathered the storm with a lot of support from my family, who kind of helped me work through this, and it lasted about a week and a half to 2 weeks. But now I feel back to normal and have been for the last week or so, where my energy level's back up. I'm back at the gym. My spirits are up. So I don't know exactly what happened, but I suspect, and this is my non-medical opinion, is that maybe it was a hormone imbalance and that just needed to level itself out. For me, I will not be able to do any hormone treatments. This journey started with going in for a testosterone therapy consultation, and I'd like to continue to do that since my testosterone is low, on the low side. But the doctor is recommending that I hold off for that for at least 2 years until my PSA is stable. Because testosterone can be a fuel for cancer, and that is the most important thing here, is that I remain cancer-free. So that's kind of how the last couple of weeks have been. Like I said, all in all, the last 2 weeks have been great. But just wanted to share my story so that if you too encounter setbacks in your recovery, lean on your family and friends for support. You'll get through it. And the most important thing is that you stay very, very focused on your recovery and getting better. So provide an update, probably in the June timeframe. I hope to have my next PSA test and good news to share.